having the tryptase elevated doesn't make any difference. Identifying mast cell activation syndrome is exquisitely difficult. And unfortunately, we make it more confusing because we use different terminologies. So mast cell disorders, mast cell activation disorders. As long as mast cell activation unspecified or mast cell activation disorders exist in the diagnostic codes, and it does, I will use those codes for a patient that doesn't have elevated tryptase, and I don't get necessarily stuck to call it mast cell activation syndrome if my colleagues insist that tryptase should be elevated there. And the approach to treatment is exactly the same. And what we expect will happen to these patients is exactly the same. So having the tryptase elevated doesn't make any difference in terms of treatment or longevity or other symptoms. But for some reason, most of our colleagues get stuck with MCAS rather than mast cell activation in general.